Well, hello, I'm Doug Apple, back with another special interview for you today. And have you seen this headline here from Tallahassee? TMH sues patient who is refusing to leave hospital room. That's the headline. What is the story behind the headline? Why would somebody refuse to leave their hospital room? What's the hospital supposed to do about it if somebody just decides they aren't leaving? We're going to talk about that with Mike Sharman. He's the general counsel of Share Healthcare, and we'll talk about Share Healthcare too here in a little bit. But Mike, you've been reading the stories about this patient right here in Tallahassee where I am. You're in Virginia. I'm in Tallahassee. You're an attorney. I'm just a radio guy. So unpack this a little bit for us about what is going on here at TMH.
Well, that's a really good question. What's going on there at Tallahassee Medical Health Center? And it is quizzical. And Doug, we talk so much about what's going on in the nation when you and I are going on our interviews, or sometimes you let me talk a lot about what's going on in Virginia. Seems like we can use a case down there in Tallahassee as a example or a microcosm of some of the problems that we have in our medical delivery services, our social services, perhaps in our legal systems. So the basic story, and you got to parse it out from a couple different news articles because nobody's giving us all the details. But so Tallahassee Memorial Healthcare, your hospital there, sued a patient. They aren't suing her for the bills that are there. I'm saying her. I don't know definitively that it is a her. No, wait. I'm looking at one of the articles. The woman was admitted to the hospital, so it is a her. Mm-hmm. So she was admitted originally for medical treatment. They mentioned that she was discharged last October. What one of the more subsidiary articles mentions, she'd been there since last May 2025. It's now March 2026. And that article also mentions that she'd been in a hospital bed that long, and yet then the doctors had said that she no longer needed medical care as of October and asked her to leave. She wouldn't. Okay, this brings up just all sorts of problems and questions. So the AP, the Associated Press article on it mentions, well, anybody who comes to a hospital with an emergency has to be admitted. They say under the Federal Emergency Medical Treatment and Labor Act, hospitals that receive Medicare funds must provide treatment that stabilizes anybody. Keep in mind that term, stabilizes anybody coming to an emergency department with an emergency medical condition, even if the patient doesn't have insurance or the ability to pay. The hospitals could be investigated for violations. Well, they're also paid when they receive that person and treat them. So that person has been being paid with federal dollars ever since last May, and still is. Just the fact that they wanted this woman to go doesn't mean they're not getting paid. Now, who ever heard of a patient being in a hospital bed, not a recovery bed, not a rehabilitation center bed, but a hospital bed from May to October before they say she's ready for discharge? I mean, have you ever heard of anybody being in a hospital that long?
Well, yeah, I'm not familiar with one.
No. And we both know a lot of people have been in and out of the hospital. But from May to October, being in a hospital, and not, like I said, not the recovery, not the rehabilitation, not discharged and readmitted for a course of treatment. All right, so that's an issue right there. Then she'd been in the hospital bed from May to October, and then they say, but she no longer needs medical treatment. Okay. But that's surprising. I mean, if you've been in the hospital bed that long, you've got a whole lot of atrophy.
Yeah.
There's issues. Then from October to March is when they filed the suit. October to March, she just said, I'm not leaving. And they couldn't do anything about that. Now, every hospital has social workers in the hospital. The social worker comes and visits, pretty much every patient, or at least reviews every patient's chart to see if they need social services. And every hospital coordinates with the local Department of Social Services. So what's going on there? And if this person just refuses to leave, well, aren't they now a trespasser? And couldn't the local sheriff be called and the person be taken out? They obviously, well, I don't say obviously, but they may have no family member because pretty much every state has a dependence law, whether it's a child or an elderly or incapacitated person. If you are their parent, their child, their spouse, you're responsible for them, even if you don't want to be. Every county has the ability to take care of people who are not able to take care of themselves. Every county, every court system in the land has an ability to take care of people who are mentally incapacitated. So what's the deal here? And every one of those systems is not using the tools it already has. And the hospital apparently is wanting the judge to be the heavy in this situation. Well, the court says you got to go. Here's the court order. Well, they could already have gotten a couple orderlies, said, look, we're donating you the bed and all the linens, and we're rolling you out onto the sidewalk where social services will meet you so that we are not being neglectful of somebody who needs care. I mean, what's so tough about that? What's going on there, Doug? It's your city.
Well, as I mentioned to you before we went on the air, I read the headline of this story, and that is all I read at first because I thought, well, that's so dumb, I'm not even going to read it. And I think our nation is lacking a certain element of people, judges, police, administrators, school teachers, who just, in the old days, you just draw a line and say, that's dumb, you're not doing it, stop, get out.
Right. Common sense is so uncommon today.
Yes. And
there's also that issue that you had mentioned as we were chatting ahead of time of everybody being so afraid of lawsuits.
Mm-hmm.
Well, so this hospital was so afraid of getting a lawsuit that they created a lawsuit, as opposed to doing common sense and saying, we're literally going to put you out on the sidewalk, but we're going to also make sure we coordinate with social services so that you're not left without care. You know, you're going to be placed appropriately where you need to be placed. Now, why should we care? Why should we, as the citizens of your town, why should they care? Why should the people around the nation who are listening to this, why should they care? Well, because it's costing all of us.
I guess we're all paying for it. And then if there's one, there's going to be more than one.
Well, even this one's going to be a couple million. I mean, a hospital stay is not cheap.
No.
And a hospital stay from May of 2025 to March of 2026, if it gets done in March, because I mentioned the court hearings not till March 30th, that's extraordinarily expensive. And I don't know I doubt seriously that the person started in a single occupancy room. But I would imagine they don't have another person in that room now because they didn't want to create the problem with that. But who knows? Mm-hmm. But anyway, it's extraordinarily expensive. This is on Medicare. We're paying for it. We're subsidizing the whole thing. And it is emblematic to me of our inability just to draw lines and say, look, we're going to care for the people who have actually medically necessary problems. And we're not going to care for those who don't. Mm-hmm. We're going to take care of those who can't take care of themselves, and we aren't going to take care of those things that other people can take care of. And that's what's going on right here. This woman does need help, obviously, but she doesn't need care in a medical hospital. She may need care in a mental health hospital, which often are no cheaper. But probably not. She probably just needs shelter care. Somebody who can help her begin believing that she can be independent and give her the means to do what she can, because there's just about nobody in this world that can't be doing something productive. And we diminish people when we allow them to maintain their dependency and not live up to the potential that they do have.
Yeah, and I would imagine that this element of the government involvement, it does erase the normal mechanism of the free market. For example, a normal business just couldn't put up with a, quote, customer who wasn't paying and didn't even need the services.
Right. Even a 24-hour restaurant like the Waffle House is not going to let a person sit in a booth for, nearly a year. Just saying, can I have another cup of coffee, please? They aren't going to do it. They can't afford to. This hospital, if they weren't getting paid for every single day, this hospital would not be changing the sheets and bringing food to the person.
Yeah, that's just another example of government involvement throwing a monkey wrench into the free market.
Right. So with Share Healthcare that I represent, we aren't accommodating this type of thing. We are a Christian ministry. Share Healthcare is a 501c3 medical missionary ministry. It's a nonprofit, of course, a 501c3. And its specific mission is to help Christians share one another's medically necessary medical expenses. And we try as much as possible to disassociate ourselves from the insurance model and the government entitlement model. The government entanglement model, too, is probably even a better way of saying it. We're exempt by the language of the statute from the Affordable Care Act. We're exempt from insurance because we're not insurance. So we are able, as a Christian ministry, to do the common sense things. We share, as I mentioned, in the medically necessary medical expenses of other Christians. We don't share in the expenses of even Christians who use tobacco, because smoking tobacco, we all know now, chewing tobacco, using vapes, we all know that's just flat dumb for your body. Mm-hmm. It is the thing that's most guaranteed to put you in physical harm. Why should we accommodate somebody else's long-term suicide is essentially what we've often heard tobacco use referred to as. We don't share in abortions. We don't share in abortifacients. We don't share in transgender care. There's certainly no way we would share in a person's medical expense from May to March when they're just hanging out and refusing the hospital to go. I mean, that just wouldn't happen. And those are just common sense things. So what does common sense get you? Well, with Share Healthcare, we're $149 per month for a single, $249 for a couple, $349 for a family of four. So how does that compare with the surrounding culture? Well, those that are still involved in all those bad models that I mentioned is $2,684 per month for a family of four. So for those, the average across the nation, let me kind of restate it. The average across the nation for a family of four to have health insurance is $2,684, and we're $349 per month. And it's not that people get some bare bones sort of thing. We're sharing in all the medically necessary medical expenses that the person has. We're not sharing in cosmetic surgery. We're not sharing in treatment for alcohol abuse. We're not sharing for treatment in drug abuse. Those are things that would not honor God and the use of them. And so we aren't assisting with it. Now, let me digress just a sec, because somebody says, well, as Christians, don't you want to help people with alcohol abuse? Well, I've been working around that for about 40 years, and I can tell you the $15,000 a month treatment places don't work. They have, relapse after relapse, recidivism. I mean, how many times have we heard people going back into the Betty Ford Clinic? What does work are Christ-centered, free residential programs. I mean, they have a great efficacy rate, not the commercial ones. So we don't need to share in the cost of it, because the places that are most effective for both drug abuse and alcohol abuse are Christ-centered, free residential programs, because that's their ministry that they're wanting to do, and it works. Just to put a plug in for Teen Challenge, which is, by the way, not for teens. The average age of the folks who go there is in their 30s. But that's a long-term residential addiction recovery program that's Christ-centered, and it really works. So for the folks out there who have a friend or a family member who's been having a long-term problem with alcohol or drugs, tell them to look up their local Teen Challenge, because they're all across the nation and they work really well. But we as the body of Christ in Share Healthcare don't need to be sharing in that, because, as I mentioned, there's other ministries that do that well. We don't have to be part of a health insurance that's paying out enormous amounts of money for those things, and they don't work. We don't need to be being part of a governmental system as much as we can stay away from it, the health exchanges, et cetera, that are paying for things that God would not honor, like abortions, abortifacients, and transgendering. We do want to be caring for and helping our Christian friends and families that are having children and want to be able to have good health care to do it, that might have come down with cancer or heart attack, broken leg, et cetera. That's what we're about, sharing other Christians' medically necessary medical expenses. Not being part of a hospital system that leaves somebody in bed from May to October and then says, hey, you got to go, and they don't do anything about it until March.
And still getting paid.
Exactly.
So I want you to talk to this group of people. Here's a headline in the current Wall Street Journal. It says, millions of Americans are going uninsured following expiration of ACA subsidies. And in fact, this says, I don't even know if this is true, but it says nearly a third of those enrolled in the Affordable Care Act plans last year have left the market after costs rose sharply. So what I'm saying is, talk to those people, if they're listening right now, who maybe they're one of that group that said, oh, can't afford it anymore. We're going to have no health insurance.
Well, leaving the marketplace exchanges is quite different than leaving the market. And there's always been a group of younger, healthy people who made a rational decision of, I really don't need insurance that's costing me almost as much as my mortgage when I know I'm not going to be spending that much on health care. And so there's always been that core group of young people who never got insurance. And that's true ever since the time of insurance. That was true during the health market exchanges from Obamacare on, and that's true now. When I read the numbers about how many millions are going to be going without insurance, that isn't necessarily the case. Many people made a rational decision that the healthcare marketplace, the government exchange, is no longer worthwhile. The high deductibles, the 80-20, the restrictions on what you get, and the mandate of how much you have to pay, it just isn't worth it. So they went out and got different insurance, or many of them have joined healthcare sharing groups. So with those that have, they might never have heard of a healthcare sharing ministry, might not have ever considered it. They just did insurance, or their employer had given it to them, and now they aren't anymore. Take a look around at healthcare sharing. It is you, as a Christian, passing the plate with other Christians across the nation and around the world. That's what it's about. You're caring for one another. You're doing it in an organized fashion. It's not just willy-nilly toss whatever you have into the plate, even though that probably would work too. It does in every church. But it is, we have a set amount. Every other healthcare sharing ministry has a set amount per month. And as I mentioned, our set amount is $149 for a single, $249 for a couple, $349 for a family of four. We have guidelines of what is shareable and what isn't. And as I mentioned, what the things that are excluded are essentially the non-biblical things. And the things that are included are medically necessary. Now, the things that are excluded are you're just drop them by your doctor when you have a cold. Well, that's something you can handle yourself. That's a load you can carry yourself. But if you went to the doctor just because you had a cold, and he says, "No, wait a second, I'm not real sure this is a cold. I want you to have a full blood scan. Let's see what's going on." And then the blood scan is problematic. And then he said, "Well, I want you to have MRI." Well, all those things from the minor doctor visit up are pretty major medical expenses. And those are the type of things that we want to be able to share as the body of Christ. The things are the burden that you and your family cannot carry on your own. The things that you can carry on your own, the simple doctor visits, the little checkups, those are the things that you should be able to budget for yourself. And why not budget for them and only pay $349 per month for the sharing on those other things, rather than pay $26.84 every single month when you don't need it?
Mm-hmm. All right, so if people want to check out Share Healthcare, what's their next step?
Well, remember our name, write it down someplace where you're not going to forget it, Share Healthcare. Then look up sharehealthcare.com, sharehealthcare.com. Read through it, click on the tabs, look at the different resources, write down your questions as you go. Then call 1-844-SHARE-HC, 1-844-SHARE-HC. And if you call during business hours, there'll be a human on the other end of the line to answer those questions. And if you call after business hours, you'll get you'll leave a message and they'll call you back the next day.
All right, so that number is 1-844-SHARE-HC, and the website sharehealthcare.com. That's Mike Sharman, and for Wave 94, I'm Doug Apple.